In the first moments of life, a child's future is not cast in stone, but in the pulses of their growing brain. Every touch, every word, every meal is a brick in the foundation of their life. In HomaBay, building these early foundations is a daily challenge.
Machiegni koda kabisa molo macha pod oluora gi kech mane an godo mokwongo cha nikech kaka nagoye cha e kaka ong'e ni pod an to kech no ne biro na kaluwore gi pek mana kale nokakalo maber ahinya kech seche mane jaoda othono noweya ka onge kata gi ot.
Ne Nyasaye nokonya gi nyako makoro luongo ni Minot. Wadak higni 4, wamako iko mar 5, tok yudo nyathiwa mar 2. Sawa me koweya gi nyathi ma ja dweche 9. Minwa bende nie higa ma koro en 67 and above. Koro yudo ka ja 67 ni ma samoro awe gi nyathi kadhi manyo skari moro akwota mondo aduogo chwak ne nyithindo gi.
Faced with these challenges, a question emerged. How do you build a stronger start for every child? The answer required a shift in thinking. Not a single solution, but an ecosystem of care. It demanded that households, community networks, and public services begin working as one.
When we talk about nurturing care, we looked at it and we saw that it is beyond health. It touches on every sector of this government and of our society. It brought in members of all the county departments, but it went further to include the civil society.
Before a child's first breath, the foundation of their life is being built. It is a sacred duty that begins with the caregivers, in the nutrition chosen, the peace nurtured, and the welcome prepared. Yet too often, caregivers do not know how to navigate this foundational role. Often they walk alone without knowledge or support to turn love into effective action.
Rem masebedo kanene community kama tiye kuom nyithindo matindo en ni mondo mi jonyuol gi chiw chiemo mopogore opogore nweng'o nok dhier wan go mang'eny. En gi nyathi matin to sechak chungne moko dumacha mondo rune nikech miyo ni be gimo chamoro maber malong'o mondo ang' okel chak odhodhi kabisa nyaka dweche 6 ok yot.
Recognizing this, the project set out to systematically build caregivers' capacity, transforming their homes, natural love, and responsibility into a confident, skilled practice of nurturing care.
It was felt that there was a need to start a project on nurturing and care, looking at how the children were suffering and how nurturing and care was not being done as it is supposed to be done.
To turn this mission into a daily reality, the project placed trusted hands directly in the community.
And we've also trained our community health promoters so that they're able to do door-to-door visitation and ensure that they identify mothers as early as they become pregnant, walk this journey with the pregnant mothers, refer them to the facilities, and support them until the 3 years post-delivery.
The main focus was on 5 components of nurturing care: good health, adequate nutrition, responsive caregiving, opportunities for early learning, and security and safety. These pillars are the interconnected elements that allow a child not just to survive, but to thrive.
ChildFund okonyo gima duong' e ngima an kama kod nyithinda te madak godo. Ket mokwongo puonja kaka nyalo wuoyo gi nyathi, opuonja kaka nyalo dak kodgi, opuonja kaka nyalo pidho nyithindo madak godo, kaka nyalo balance negi chiemo ma gichamo, opuonja. Omiyo ang'eyo ni nyathini ka en e age marom kama onego cham gini kod gini gi gini gi gini.
The support extended beyond individual homes into the heart of the community. By forming caregiver groups, the project fostered powerful peer networks where knowledge was exchanged, solidarity was built, and the responsibility for children became a collective commitment.
So this group is called Achievers Male Caregivers. Apart from the trainings that we get here or the teachings that we get, we have some financial help where we just put our monies together and do table banking. That has promoted unity amongst us and has brought a number of men together. And we've done so many sessions concerning nurturing care. So today as we speak, there is a great change in this group and there is also a great change in the community.
Kane pok adonjo e puonj to nok ang'eyo gima janyuol en maber. Nana kodgi kanyo ni Nyasaye omiyagi atema kaka dhano nyalo temo. Koro nyaka adonjo e puonj. Sebedo gi lokruok ma ang'eyo ni nyithindogo winjo bed ni abedo kodgi kanyakla.
Special male caregiver groups challenged the long-held norm that childcare is solely women's work.
Weche mwayudo e group ka konya maduong' moloyo wafwenyo ni ei family owinjo bed ni ji timore nade. Ji nywako tich kanyakla kaka jonyuol. Manyiso ni onge gimoro ni en mar mama, en mar miyo. Nitie gik mang'eny mane waweyo kwa uparo ni magi to manang'o. Kare nyathi owinjo bed ni an aluoke. Owinjo bed ni amiye chiemo. Owinjo bed ni akawe ating'e e osiptal. Mamago programs mane wawene mon. Koro nyaka ne organization ni donji, yot osebede nikech programs gi. Ananena ka nyathina ngimane chalo gima olokore ni aringo kode ok akini dani tena go osiptal. Akawo thuolno nikech this organization mane wayudo puonj mayudo kanyo. Oloka to loso nyaka dir dalawa.
This redefinition of masculinity is quietly revolutionizing homes, proving that when men become active partners in nurturing care, the entire foundation of the family grows stronger.
Jogo ma ok wan godo e group kata ma ok nie group ma wantiere ni okawa kaka joma pachgi tin. Nang'o? Ginyalo biro dala ni giyudo ka luoko saende, mare luoko lewni, mare luoko nyathi. Kodok chien kucho ko ni adhi ka koyomno kata yudo maka nyiencha dhako loyo luoko mang'o lewni maro luoko nyithino yudo nyaka kotedo. Koro gin bende aka yudo gi ta puonjo gi apuonja koluwore gi puonj ma yudo ng'o group ni.
Becoming a mother too early comes with overwhelming challenges. Interrupted education, stigma, financial strain, and emotional stress. For these girls, many of whom are returning to school, the project offers guidance, emotional reassurance, and the confidence to balance learning with motherhood, ensuring both mother and child can thrive.
We've been taught on how to raise our children. I didn't know how to even breastfeed my child at first, but through the organization, the madam has taught us. So I know how to play, how to breastfeed, and so on with my child.
A family's capacity to provide nurturing care is only as strong as its ability to put food on the table. Recognizing this, the project integrated direct livelihood support into its core mission, providing assets like chickens, goats, and sheep, and training in kitchen gardening and small enterprise. This empowers caregivers not just with knowledge, but with concrete means to provide.
En gi lokruok gi puonj mosebedo koyudo, oya gi rombo moro manyalo lokore ne dhiang'. Emomiyo giherogi. Giherogi kabisa. Ni gini karanyuka biya saa 8 kabire puonjruok, kech nwaromo ga saa 8. Okoringa ko bire puonjruok kowe gigene monego losi to ongo hala moro modhi yud.
Organization ni osekelo wamukunyo mukonwa ni olemo gi kitchen garden en gima important yango e family. Koro miya mako wacho lembe gi matek aloso gi kang'e maber ni gigi nti kare gin konyruok e family.
In the villages of Ndiwa, success stories are emerging not as isolated incidents but as a gathering wave of change,
In this project, we have a total of 1,800 caregivers spread across the 2 counties, and together with their children, also 1,800. And it has been implemented in cohort stages. That is, in 1 year, we enroll quite a number. Then we take them through the Responsive Protective Parenting Program, which is the model within ChildFund International on parenting, on responsive parenting, whereby the parents are taught through a package of parenting which rolls for like 10 months, and in each month they are meeting twice at a venue at a time of their convenience, and in each meeting time they take not more than 2 hours.
Household by household, these individual transformations are building a new community consensus that investing in the earliest years is the most powerful choice a family and a community can make for its future.
We've learned that the groups that the male caregivers come with their spouses in the sessions, their spouses have been able to register that there is improvement, there is peace. Cases of gender-based violence have reduced. That is one of the lessons. Another lesson that we've learned is that we need a targeted intervention exclusively for teen moms. Especially during year 1, we had groups where we had teen moms mixed with other groups. But again, we found out that they were not free to share some of the issues affecting them, because for instance, you get that maybe they're sharing a group with the aunt or their mother, so there was no safe space for them. Another lesson that we've learned is that, again, when we target the teen moms, beyond parenting as a package to them and also psychosocial support, these teen moms, we have a number of them who have gone back to school and they're in need of school fees support, among other things. So we really need to support them beyond the parenting package and also support them with school fees and other challenges that they face.
Lasting change requires many hands on the loom. So, this project wove itself into the very fabric of HomaBay.
As an NGO, for how long will we be here? We can't be here forever, but the government is here to stay, the community is here to stay. So that's why strengthening the government, ensuring that the government has adequate staff, that it can budget for the components of the nurturing care, and then that the communities are aware and they know where the service is, they can be able to get that service. That makes us happy.
This was the true partnership, not leading from the front, but sitting alongside, ensuring that every lesson learned would become a permanent thread in the county's future.
An kaka wajogiru bwacha ningeche nyocha wasesomo mabuk manwasomo nyocha wasetie to nyocha wabedo piny nikech gini en gin manwadonje komorowa, ok en gima nochunwago. Koro nwawacho ni wan kata bed ni puonjo rumo, ok wabiweyo mok wadhi e meeting, ningeche gik mwayudo e puonj cha wayudo ka lokruok nitiere. Koro nyocha wasewinjore ni bugu cha, nikech nyocha wasepuonjore mwatieke, nyocha wayie dok omegi e tiende mondo mi wachak watimne review, mondo mi koma ne ok wawinjo maber kata mapod chachowa mondo med donjo e wiwa, to wadhi kode gi riwruokno mondo med kelonwa lokruok kaka e dakwa malach.
Indeed, nurturing care builds strong families. Strong families build empowered communities. And empowered communities will always secure the brightest future for their children.